Okay, so the chapter is hemodynamic disorders, thrombosis and shock. So as we all know, the health of the cells and the tissues, it depends on intact circulation and normal fluid hemostasis. And the integrity of the vessel wall is really important for the normal hemostasis to occur, intravascular pressure and osmolarity. So these are the three factors which are important for normal fluid hemostasis. And if there is any increase in the vascular volume or pressure, or there is decrease in the plasma protein content, or there are alterations in the endothelial function. So if there is these three reasons are there, then what will happen is they can result in net outward movement of water across the vascular wall. And such extravasation of water into the interstitial spaces is known as edema. So depending on its location, the edema can have little effect or it can have profound effect. Edema can occur in the lower extremities, which is very common and is mostly it is a dependent edema. Edema can occur in the lungs, then edema will fill the alveoli and can result in life-threatening breathing difficulties. So normal fluid hemostasis is maintaining blood in a liquid state until any injury occurs which necessitates the formation of clot. So basically the blood is supposed to flow in a fluid state unless there is any injury, in response to which the blood is supposed to clot to prevent extra blood loss. Absence of clotting after vascular injury, it results in hemorrhage which can be local and can compromise the regional tissue perfusion. There can be more extensive hemorrhage which can result in hypotension, shock and death. On the contrary, the opposite thing is when the blood clots. So inappropriate clotting. If there is injury and then the blood is clotting, then we call this, yes, this is needed, that is appropriate. Okay, if there is inappropriate clotting, we call it thrombosis. There is migration of clots, it is known as embolism. And if it obstructs any blood vessel and the area supplied by it is ischemic, then that process is known as infarction. So abnormal fluid hemostasis underlies three most important causes of morbidity and mortality, which are myocardial infarction, pulmonary embolism and stroke. So edema. Approximately 60% of the lean body water weight is water, 2/3 is intracellular, rest is extracellular in the interstitial compartment, and only 5% of the total body water is in blood plasma. What is edema? Edema is increased fluid in the interstitial tissue spaces. What are the interstitial tissue spaces? The spaces in between the cells. Okay, and it depends on which cavity it is occurring. If it is in the thorax, in the pleural cavity, it is known as hydrothorax. Similarly, hydropericardium, hydroperitoneum, which is commonly known as ascites, and anasarca. Anasarca is severe and generalized edema with profound subcutaneous tissue swelling. Now, edema can be because of inflammatory causes and non-inflammatory causes and occurs mostly because of opposing effects of, please don't talk. So, opposing effects of vascular hydrostatic pressure and plasma colloid osmotic pressure. Normally what happens is the exit of fluid into the interstitium from the arteriolar end is nearly balanced by inflow at the venular end. So we all know vein se jitna aayega artery se utna niklega. When that balance is disturbed, it leads to a problem. Normally what happens is the lymphatics, they will drain a small residual amount of excess interstitial fluid. Either increased capillary pressure or diminished colloid osmotic pressure can result in increased interstitial fluid. Now this is a diagram in which you can see there is a balance of vascular hydrostatic pressure which is exerted towards inside out, and the plasma colloid osmotic pressure. So this balance has to be maintained, and small amount of fluid which exudes outside is removed by the lymphatics. And as extravascular fluid accumulates, normally what happens is if there is a small amount of inflow, what will happen is body will try to achieve a new equilibrium and water re-enters the venues. Excess interstitial edema fluid is removed by the lymphatic drainage, and ultimately it is returned to the bloodstream via the thoracic duct. If there is lymphatic obstruction because of any scarring or because of presence of any tumor, it can impair the fluid drainage and cause edema. So the amount which is being exuded into the interstitial fluid, that is also not removed because of lymphatic obstruction. In that case, it can be because of scarring, it can be because of any tumor in the lymphatics. Finally, what happens is there is sodium retention, which is obligatory associated with water, and it can cause due to renal disease, and it can also cause edema. So the edema fluid occurring with volume or pressure overload under conditions of reduced plasma protein is typically protein poor and has a specific gravity of 1.020. Less than that, that is transudate. So there are two types of edema fluids. One is transudate and one is exudate. Transudate is something which is just filtered out. प्रेशर की वजह से द फ्लूइड इज आउट बट देर इज नो इन्फेक्शन एज सच, देर इज नो प्रोटीन एज सच, इट इज नॉट प्रोटीन रिच. ठीक है, बहुत सारा पानी था, बहुत सारा था, फिल्टर होकर बाहर आ गया, समथिंग ऑफ दैट सॉर्ट. So it is because of only volume or pressure overload. Under the conditions of reduced plasma protein, it is typically protein poor and specific gravity is less than 1.012. That is known as transudate. Conversely, because of increased vascular permeability, inflammatory edema is protein rich with the specific gravity usually greater than 1.020. That is known as exudate. So this difference is important. Increased hydrostatic pressure. Localized increase in the intravascular pressure can result from impaired venous return. Lower extremity DVTs, deep vein thrombosis, they can cause edema restricted to the distal portion of the affected lung. And generalized increase can cause congestive heart failure affecting the right ventricular cardiac function. In congestive heart failure, what happens is the reduced cardiac output, it leads to reduced renal perfusion. And this renal perfusion, hyperperfusion, it triggers the renin angiotensin aldosterone excess and it induces sodium and water retention by the kidneys and causes secondary aldosteronism. This mechanism normally it functions to increase the intravascular volume and it tries to improve the cardiac output and to restore the normal renal perfusion. But if by any chance the heart is also failing and it cannot increase the cardiac output, the extra fluid overload, it causes edema. Okay. Reduced plasma oncotic pressure. This is because of albumin. It is a serum protein most importantly responsible for maintaining the intravascular colloid osmotic pressure. If there is reduced osmotic pressure, it can be because either the albumin is not properly synthesized or it is being lost from circulation for any reason. So the important cause of loss of albumin is nephrotic syndrome, in which the glomerular capillaries they become leaky and the patients typically present with generalized edema. रिड्यूस्ड एल्ब्यूमिन सिंथेसिस मतलब एक या तो चीज बनेगी कम या तो बन पूरी रही है तो एक्सक्रीट ज्यादा हो रही है, ठीक है, लॉस ज्यादा हो रहा है. सो दे आर ओनली टू कॉजेज इन विच दिस कैन अकर. सो रिड्यूस्ड एल्ब्यूमिन सिंथेसिस अकर्स इन द सेटिंग ऑफ डिफ्यूज लिवर डिजीजेस causing cirrhosis or due to protein malnutrition. Lymphatic obstruction, the most common parasitic infection is filariasis and it results in the edema of external genitalia and the lower limbs, and it can be so massive as to learn on the name elephantiasis. So this is the picture of a parasitic infection affecting inguinal lymphatics and resulting in elephantiasis. Cancer of breast, similarly, when the lymphatics are affected. During cancer of breast, what happens is the lymphatics are infiltrated by the tumor cells and they are retracted. And because of the retraction, what happens is the surface, the skin of the breast looks like an orange peel. Okay, तो उसमें ऐसे गड्ढे बन जाते हैं ऐसे, so because of the retraction. Okay, and that is why it is known as pudy orange or orange peel appearance. Sodium and water retention can also be a primary cause of edema. Increased salt with obligate accompanying water causes increased hydrostatic pressure and reduced vascular osmotic pressure, and it can lead to post-streptococcal glomerulonephritis and acute renal failure. So to summarize, edema is an extravasation of fluid from vessels into the interstitial spaces. It may be protein poor, which is transudate, protein rich, which is exudate. Edema results from increased hydrostatic pressure caused by reduction in the venous return in heart failure, decreased colloid osmotic pressure, reduced concentration of plasma albumin due to decreased synthesis like liver disease or increased loss in kidney disease. Lymphatic obstruction, which can impair the interstitial fluid clearance like scarring, tumors or infection. Primary renal sodium retention in renal failure, and increased vascular permeability in inflammation. Morphology. Edema is most easily recognized grossly. Although any organ or tissue in the body may be involved, edema is most commonly encountered in the subcutaneous tissues, the lungs, and in the brain. Dependent edema is a prominent feature of cardiac failure, particularly of the right ventricle. Edema due to renal dysfunction or nephrotic syndrome is generally more severe than cardiac edema, and it affects all parts of the body equally. There is, for the kidney lesions, the important aspect is there is a periorbital edema, so it is easily diagnosed, and there is something known as pitting edema when we press the finger on the edematous part, and when we release the finger, this pitting area or the depressed area, it remains for some time. It doesn't come out normal. The skin doesn't restore its normal place easily. So this is known as pitting edema. Pulmonary edema is the most common clinical problem, most frequently seen in the setting of left ventricular failure. It can also occur in renal failure, ARDS, which is acute respiratory distress syndrome, pulmonary infections, and hypersensitivity reactions. Lungs, they typically weigh 2 to 3 times more than the normal weight, because normally there is air which is present in it. Now it is replaced by the fluid. So obviously the weight increases. When you cut the lung, what happens is you can see the frothy blood tinged fluid representing the mixture of air, edema fluid, and extravasated red cells. So in सबका mixture होगा अगर आप lung को काटेंगे तो. So this is, the above picture is the normal lung, normal alveoli of the lung, and in this one you can see the pink fluid which is causing some sort of congestion in the lungs, and you can see even the breaking of the alveoli spaces are dilated. They are broken off, the walls are broken. Edema of the brain, it can also be localized, it can also be generalized. It can occur because of trauma, local or generalized edema depending on the nature or the extent of injury. With generalized edema, the brain is grossly swollen with narrowed sulci and distended gyri, showing the signs of flattening against the unyielding skull. Clinical correlation, the effects of edema may range from merely annoying to rapidly fatal. Subcutaneous tissue edema in cardiac or renal failure is important because it indicates the underlying disease. So edema itself, it is not a disease, it is sort of a symptom. It is giving you a clue to the underlying disease. What is the pathology? It is just guiding you towards the basic disease, or like jaundice. Jaundice itself is not a disease, it is a symptom, it is a clue, so that you can proceed and follow up the patient or diagnose the patient as to where the problem exactly lies. So pulmonary edema can cause death by interfering with the normal ventilatory function. It impedes the oxygen diffusion and causes a favorable environment for bacterial infection. Brain edema is serious and can be rapidly fatal. It can cause herniation of the brain through the foramen magnum, and the brainstem vascular supply can also be compressed by edema, causing increased intracranial pressure. In either state, it can also injure the medullary centers and cause death. So this was edema. Now this is the today's lecture, hyperemia and congestion. So the terms hyperemia and congestion, both of them indicate local increased volume of blood in the particular tissue. Hyperemia means वहाँ भी blood ज़्यादा है, congestion में भी blood ज़्यादा है. Okay, but hyperemia is an active process and results from augmented blood flow due to arteriolar dilatation. It can occur at the sites of inflammation or skeletal muscle during exercise. So, if it is because of skeletal muscle during exercise, it is a physiological cause. Sites of inflammation, it is a pathological cause. The affected tissue is redder than normal because of engorgement with oxygenated blood. Arteries are carrying oxygenated blood. So, the affected area will have that red coloration to it. Okay. And it is active because the blood is coming, actively moving into the arteries. Congestion is a passive process. Blood वहाँ से निकलना था, निकलना बंद हो गया, तो वहाँ रह गया. So there is some sort of stagnation there. Active process में artery में blood आता है, तो there is a flow. ठीक है, तो वो active process है. Congestion में क्या है, उसको vein से बाहर जाना था, but वो गया नहीं, रुक गया. So the flow is stopped. So there is stagnation there. तो क्योंकि बाहर वो अब कुछ काम नहीं कर रहा, ब्लड वहां पे रुका हुआ है. सो इट इज अ पैसिव प्रोसेस एंड इट इज रिजल्टिंग फ्रॉम impaired venous return out of a tissue. It may occur systemically in cardiac failure or locally in isolated venous obstruction. Now in congestion the tissue has blue red color. उसमें क्या था, bright red, because the blood is oxygenated in the arteries. यहाँ पे it is not oxygenated, so उसका कलर क्या होगा, नीला सा होगा, cyanosis होगा, there is cyanosis here. Worsening condition can lead to accumulation of deoxygenated hemoglobin in the affected tissues. Congestion of capillary beds is closely related to the development of edema. So congestion and edema go hand in hand. Both of them occur together mostly. Long-standing congestion is known as chronic passive congestion, a stasis of poorly oxygenated blood. Congestion of capillary beds is closely related to the development of edema. Long-standing congestion is known as chronic passive congestion. It is because of chronic hypoxia resulting in degeneration or death of the parenchymal cells and subsequent tissue fibrosis. Capillary rupture at the sites of chronic congestion causes small foci of hemorrhage, phagocytosis, catabolism of erythrocyte debris resulting in the formation of hemosiderin-laden macrophages. So what is happening is वो जो hemorrhage हुआ है RBC टूटे हैं उनमें से क्या निकलेगा? Pigment deposition होगा, phagocytosis होगा, pigment deposition होगा. So because of this pigment deposition in the macrophages, they are known as hemosiderin-laden macrophages. Okay, the slides also I think will be shown to you in your practical classes. So cut surfaces of hyperemic and congested tissues are hemorrhagic. Microscopically, alveolar capillaries are engorged with blood. Alveolar septal edema or focal intra-alveolar hemorrhages occur in acute. In chronic ones, what will happen is the septa will become a little thick and fibrotic because the problem is there for some time. So the septa are thickened. Alveolar spaces contain numerous hemosiderin-laden macrophages and they are known as heart failure cells. In acute hepatic congestion, central vein and sinusoids are distended with blood. There is central hepatocyte degeneration. The periportal hepatocytes are better oxygenated because of their proximity to the hepatic arterioles. Therefore, they undergo less severe hypoxia and may develop only fatty change. So, chronic hepatic passive congestion, what happens is there is an appearance of nutmeg liver. ये जो नाम है ना फैंसी से ये पूछते हैं वायमा में, ठीक है. हेमोसिडेरिन हार्ट फेलियर सेल्स क्या होते हैं? तो नाम हार्ट है बट यू शुड नो दैट दे आर प्रेजेंट इन लंग में हो रहा है, ठीक है. सो यू शुड नो दिस. Okay, the central regions of the hepatic lobules are grossly red brown and slightly depressed and are accentuated against the surrounding zones of uncongested tan, sometimes fatty liver and is known as nutmeg liver. So this is hyperemia. This is normal flow. आर्टरी से उतना आ रहा है उतना ही वेन से जा रहा है. हाइपरीमिया में क्या है? द इनफ्लो इज मोर बट द आउटफ्लो रिमेन्स द सेम. तो ब्लड इज एंटरिंग मोर, उसकी वजह से हाइपरीमिया हो रहा है. कंजेशन में क्या है? द इनफ्लो इज द सेम बट आउटफ्लो हैज रिड्यूस्ड, बिकॉज ऑफ दैट द ब्लड इज पूलिंग इन. दैट इज व्हाई इट इज ब्लू और cyanosed. So both of them have increased volume of blood in the tissue. Hyperemia is an active process. Arterial dilatation is there. Skeletal muscle exercise is a physiological cause and inflammation is pathological cause. Congestion is a passive process. There is impaired venous flow. Outflow, cardiac failure is a systemic cause and venous obstruction is local. So this is a diagram of the lung of acute pulmonary congestion. You will find the patient will come to you with a manifestation of pink colored foamy sputum. मुझे बलगम आता है पिंक कलर का खांसी के साथ. So that will be the complaint of the patient. So grossly plump swollen lung with shining pleura, edematous fluid flowing out while cutting the lung. ऐसा होता नहीं है, इसकी आती नहीं है सच. ये तो ऑटोप्सी की फाइंडिंग्स होती हैं. When the patient dies and they study ये वो फाइंडिंग. ऐसा नहीं होगा कि पेशेंट आपके पास आएगा तो आप उसका लंग निकालोगे और करोगे, ऐसा कुछ नहीं होगा. But you should know all these things because they have studied all this on autopsy. On low microscopy, alveolar capillaries are highly dilated, rosary-like appearance with engorged with blood. Alveolar cavity filled with eosinophilic edema fluid. Manifestation is pink colored foamy sputum. इसमें manifestation क्या है? Chronic में rusty sputum, क्योंकि हमें hemosiderin-laden macrophages थे. Chronic हो गई प्रॉब्लम, उसमें पिंक था क्योंकि ताजा था वो ब्लड, ठीक है. इट इज पिंकिश रेडिश ऐसा. इसमें इट इज रस्टी एंड द प्रॉब्लम इज accompanying problem is dyspnea, that is difficulty in breathing. इसमें क्या होगा? Grossly the lung will be hard with brown spots scattered known as brown induration. The septa is thickened and fibrosed. Alveolar spaces have heart failure cells which are hemosiderin-laden macrophages. So these are the chronic pulmonary congestion and the brown cells, they are hemosiderin-laden macrophages and the brown color is because of pigment hemosiderin there. So this is congestion of the liver, acute hepatic congestion. On low microscopy, there is dilatation of the central vein and sinusoids with blood. There is atrophy, degeneration, and necrosis of central hepatocytes. On chronic hepatic congestion, it is known as nutmeg liver. Grossly, there are red-brown zones accentuated against the yellow surrounding zones. On low microscopy, centrilobular necrosis and congestion is there, and perilobular fatty change and fibrosis is there. Long-standing severe hepatic congestion causes hepatic fibrosis, and again it is known as cardiac cirrhosis. So these terms, heart failure cells, cardiac cirrhosis, you should know कि हो कहाँ रही है ये problems. It is not in the heart. So this is again the picture of centrilobular congestion and necrosis, which is nutmeg liver. Again, this is cardiac cirrhosis, in which you can see these bands, the pale bands which are crossing. They are all because they are bands of fibrosis. This is all fibrosis. So coming to hemorrhage, this is extravasation of blood from the vessels into the extravascular space. Capillary bleeding occurs under the conditions of chronic congestion. An increased tendency to hemorrhage with insignificant injury occurs in clinical disorders collectively called hemorrhagic diastasis. And rupture of large artery or a vein results in severe hemorrhage, in trauma, atherosclerosis under inflammatory conditions, and neoplastic erosion of the vessel wall. So hemorrhage can be external, it can be confined within a tissue, and any accumulation is known as hematoma. Hematoma can be relatively insignificant, called as bruise. अभी आप यहाँ से निकले, ये लग गया दरवाजे का कुंडा, पड़ गया थोड़ी देर में नील, ठीक है? That is simple bruise which everybody has encountered. Or it can involve so much bleeding so as to cause death. A massive retroperitoneal hematoma resulting from rupture of dissecting aortic aneurysm. So hematoma can be as insignificant as a bruise to as fatal as a hematoma in DIC to cause death. So this is how they are graded: 1 to 2 mm hemorrhages into the skin or mucous membranes or the serosa. They are known as पेटिकिए. कभी कभी हमें दिखता है स्किन पे छोटे 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 से लाल लाल से दाने दाने से होते हैं. 1 to 2 mm hemorrhages, they are petechiae. They are associated with locally increased intravascular pressure, thrombocytopenia, defective platelet function, and clot factor deficiencies. 3 to 5 mm hemorrhages are called purpura. They occur in trauma, vasculitis, and increased vascular fragility. And 1 to 2 centimeter subcutaneous hematomas or bruises are known as echimosis. So what happens here is erythrocytes in the hemorrhages are phagocytosed and degraded by macrophages. The hemoglobin, the red-blue color, is enzymatically converted into bilirubin, which is blue-green in color, and eventually into hemosiderin, which is golden brown in color, accounting for the characteristic color changes in hematoma. जब नील पड़ता है तो शुरू में तो वो नीला नहीं होता, स्टार्टिंग में तो पता नहीं चलता चोट कब लगी थी, कुछ दिन बाद पता चलता है निशान हो रहा है, ठीक है? These, if you follow it, you will realize that these are the colors through which that bruise or that injury goes through. Okay, and this is because of this reason कि शुरू में hemoglobin है, which is red blue in color, then it is converted to bilirubin, which is blue green in color, and then to hemosiderin, which is golden brown, and eventually it fades off and resumes the color of the skin. Large accumulations of blood, depending on the cavity, they are known as hemothorax, hemopericardium, hemoperitoneum, and hemarthrosis in the joints. Patients with extensive hemorrhages occasionally develop jaundice from massive breakdown of red blood cells and systemic increases in bilirubin. Clinical significance depends upon volume of loss and the rate of blood loss. Rapid removal of as much as 20% of the blood volume or slow losses of even larger volume may have little impact in healthy adults. Greater losses can be hemorrhagic, causing hypovolemic shock. So basically क्या होता है, road traffic accident is the most common cause here. ठीक है, 20% अचानक से खूब सारा निकल गया ब्लड, बट आपने उसको केटर कर लिया, इमरजेंसी में ठीक हो गया, तो बॉडी विल ट्राई टू कॉम्पनसेट. इनिशियली if there is any injury, if there is any infection, body always tries to compensate to the best. अब हम anemic individual की बात नहीं कर रहे हैं, we are talking about a healthy individual. ठीक है, तो अगर इतना परसेंट, एटलीस्ट 20% ऑफ द रैपिड ब्लड लॉस इज असेंशियल, कम से कम उससे ज्यादा होगा तो हम उम्मीद कर सकते हैं पेशेंट सीरियस है. उतने को इफ द पेशेंट हैज एडिक्वेट हीमोग्लोबिन, ये दिस इज इंपॉर्टेंट, अगेन एंड अगेन आई एम सेइंग, बॉडी विल try to compensate and we can expect the patient will be okay. But if there is a slow loss of even larger volumes, क्योंकि slow loss है पर उससे ज्यादा भी अगर चला गया, बॉडी को टाइम मिल रहा है कॉम्पनसेट करने के लिए, तो बॉडी कॉम्पनसेट कर लेगी, बट वो इतना ज्यादा भी नहीं होना चाहिए कि होते ही जा रहा है ब्लड लॉस, उतना ज्यादा नहीं। बट यस, अगर अक्यूट है, खूब सारा ब्लड लॉस हुआ है पर 20% से कम ही है, तो वी कैन सेव द पेशेंट, ये पर्पस है कहने का, ठीक है। एंड इफ देयर इज अ स्लो लॉस, तो बॉडी हैज द टाइम टू कॉम्पनसेट, वो कोशिश करेगा कॉम्पनसेट करने की। सो दीज आर सम positive factors here, but if there is a greater loss, then definitely patient will go into shock. The site of hemorrhage is also important. अब the bleeding could be travel in the subcutaneous tissues, may cause death if it is in the brain, ठीक है। इसीलिए सबसे पहले रोड ट्रैफिक एक्सीडेंट होता है, सबसे पहला क्वेश्चन क्या, सिर पे चोट तो नहीं लगी, क्योंकि पता है कि कहीं भी होगी, बच सकती है, सिर में हुई तो इतनी सी भी फेटल हो सकती है। तो अब यहाँ पे 20% की बातें नहीं करेंगे कि 20% तो बोला था, तो 20% तो हुई नहीं, हो सकता है इतनी सी 1 ml भी अगर वाइटल एरिया में है तो गया पेशेंट। सो द साइट ऑफ हेमरेज इज ऑल्सो इम्पोर्टेंट। Bleeding that would be travel in the subcutaneous tissues may cause death if located in the brain. Finally, chronic or recurrent external blood loss like peptic ulcer or menstrual bleeding can cause net loss of iron, frequently culminating in iron deficiency anemia. In contrast, when the red cells are retained, the iron can be reutilized for hemoglobin synthesis.